Tonight on Recruits, Rebecca attends a family in crisis.
Listen to me, what's going on?
Evan takes the lead in a multi-car pile-up.
Nothing prepares you for the adrenaline rush that you get being the first ones to turn up and go, crap, it's us, and that's it.
And Jenna deals with tears and broken bones.
What's wrong with that x-ray?
That should be there.
I'm addicted to this universal feeling called life.
He's been hit by a car. This just collapsed.
I'm getting sick.
Across Australia, someone calls for an ambulance every 15 seconds.
Ambulance emergency, what suburb are we coming to?
In emergencies, an ambulance can be dispatched within 30 seconds. It takes months of training before operators are equipped to handle 000 calls.
You certainly get your intense calls and you've got to be on your toes.
She won't wake up and she's cold.
From knee pain to cardiac arrest. I mean, they can still be absolutely panicked.
No breathing at all, okay? We need to start some compressions. Listen carefully, I'll tell you how to do resuscitation.
A lot of the time they are absolutely screaming down the phone. They forget where they are, they're just absolutely blank. And I suppose you've got to put yourself in their shoes. If that was you, I'm sure we probably would handle it the same way.
Mid-afternoon, an emergency call comes in from Sydney's west.
Ambulance emergency, what suburb are we coming to? What is the problem? Tell me exactly what's happening.
The baby's like unscreaming.
The baby's having breathing problems. I can't hear you because there's too much screaming.
While the operator tries to get more information, an ambulance is already dispatched.
555 responding to the 1C, abnormal breathing.
Trainee paramedic Beck and mentor Chris are closest to the scene.
There you go. This guy here waving us.
Hello. Come over to the car, darling. Hello, darling. Actually, sit the bed up, mate, and we'll get us home to bed.
9-year-old Sunday has suffered diarrhea and vomiting for over a week. She's been to hospital once already, but her condition is deteriorating.
Hop on the bed.
Her family are highly distressed.
You feel very hot, sweetie. How long have you been sick for? A lot of days.
The family are recent refugees from Sudan.
She's very hot.
Yeah.
What's wrong?
No,
Sunday's mother is 7 months pregnant. She has been tending her sick daughter 24 hours a day.
Please, can I stay with my daughter? Because I don't have anyone. Listen to me, what's going on. So do you hear me? My daughter was getting sick.
Lack of sleep and high emotion take their toll.
And I want to stay in my daughter here.
Yeah, she's just there.
Come and sit over here, darling. Come and sit over here.
What's been going on?
Her mother's still a bit sick as well now.
In some situations, when a family member's sick, all logic can go out the window. And that was happening with the mother. She's really worried about her daughter, and that's quite obvious. Okay, she needs to look after your daughter, all right?
Okay.
And try and find out what's wrong.
No.
So you need to be calm and not yell and scream, okay?
No.
Do you want to get in the ambulance with your daughter?
Yes. We're just going to put an oxygen mask on to give you some more oxygen, okay?
Children are particularly susceptible to the debilitating effects of dehydration.
With diarrhoea, you can lose a lot of electrolytes. If you're vomiting and you've got the diarrhoea, it's a double whammy. And yeah, so she can be quite sick. They normally tend to ride these sorts of conditions out, mate, and they tend to get better. But sometimes a very small percentage of people won't get better and you need to go back to hospital. She'll be okay, mate. She'll be okay.
Okay, no problem. Yeah, all right.
We're going to get going, mate. Okay, I'm just going to close this door, champ.
Yeah, this one.
Okay, good, mate.
Can I just... I need you... Can I just get you to be quiet for a second just so I can take your daughter's blood pressure?
Seems to be okay.
No, that's all right. Just so I can take her blood pressure. Anyway. That's all right.
I found it very hard to take her blood pressure with the mother yelling because I couldn't hear the child's heartbeat.
You right to go?
Yeah, right to go.
She's okay, darling.
I think I relate pretty well because of my children. Being a paramedic, also your motherly instincts kick in as well, so you're sort of playing two roles when it comes to children.
At hospital, Sunday was treated with intravenous fluids to rehydrate her. Her mother, Adut, was also admitted for observation.
Very good evening from Richmond. Richmond Station. Tonight, Officers Thomas and Terry in 349 with Portable Richmond 6.
In Richmond, former IT worker Evan signs on for night shift.
The learning curve is still very steep, and everyone keeps telling me it's going to be 5 years before I'm over the hump, so I'm trying not to look up the hill too often. For some reason I read that as Berkshire.
7-Eleven, roundabout Richmond Road.
Oh, okay, that's the new one. Oh, is it? It's an MV8, is it?
Yeah, rollover.
Rollover? What do you mean rollover?
Vehicle rolled over.
Oh, vehicle rollover. Rollover, right. Yeah, I don't know why I interpreted that as an instruction just then.
Today, Evan is being given the responsibility of lead paramedic. It's his first time in the role.
Now's the right time to push Evan's boundaries, get him to make a few decisions and act on his own instinct. I think this is a good case to push him a little bit because it's something he hasn't experienced yet.
The Ambulance Control Centre advises a passenger is still trapped in the vehicle.
So as I'm approaching the scene, I'm looking for things like wires, traffic, access, other vehicles, debris.
Evan's unit is first on scene. His critical role is to triage patients, identify how many, and prioritise their treatment.
G'day. What's going on? Just this car?
No, not this. Got one here as well.
Yep.
But, this fella's...
You here for a moment while I just go and check the other car quickly? Was anyone else in any cars involved in the accident?
A string of vehicles were rear-ended in the accident. James, an 82-year-old grandfather, has taken the brunt of the impact.
He's got a big gash on his head.
Yeah,
his
so a
chest
big gash.
is sore, and he's got a whopping headache.
A passing nurse stopped to help. She immediately tried to stem blood flow from James's head.
Nothing prepares you for the adrenaline rush that you get being the first ones to turn up and go, crap, for a little while it's us. And that's it.
What have you got?
At this stage, the only patient I've been able to identify is the gentleman in this car who has a decent laceration to his head. He's also complaining of some chest pain. I haven't investigated that further yet.
The sudden impact may have caused serious internal injuries.
Hi, my name's Evan. Can you hear me?
Yes, I can.
What's your name, mate?
James.
Okay, I'm just going to pull this back ever so slightly. Just have a look at what's going on here. Yeah, that's a good gash. Do you remember the accident?
No, I don't.
You don't? There was a lot of blood, and given that it was coming from his head, that was quite concerning. That's the way.
So where do you think his head may have been when you've got blood splatters there?
Coming out this window, I would say.
It looks like as the vehicle's come across the back of the car, it's rolled onto its roof, slid on the road for an unnamed period of time, hit a tree and then rolled multiple times. During those rolls, it looks like there's evidence that his head struck the road at least once.
Open your eyes for me if you can. This is a really hard job. It's my first major trauma where I'm the treating officer, and Craig was pretty determined to make me find my feet.
Got a nurse there to help you. If she's happy to help, use that, go for gold.
Having assessed the scene, Evan needs to begin treating James.
You feeling sick, sir?
I'm not feeling too good.
As his mentor watches on.
Craig.
82-year-old James has rolled his car. It's the first time Evan has been put in charge as treating paramedic.
You rock up at this scene, there's cars everywhere, there's people everywhere. They just expect me to be another paramedic and know what I'm doing and get in there and take control, and that's a hell of a lot of pressure. Craig?
What injuries do we have?
He's got a really good abrasion and a laceration just above his forehead. Yep. But his pupils were equal and reactive to light risk. Normal sinus rhythm.
So take a breath, stepping back for a second. Everything's normal. So in terms of treatment, everything's going to be good. Yep. Just going to spine board. It's just a normal spine.
Am I over a bit?
You doing? No, you're doing good, but just chill.
As intensive care paramedics arrive, Evan does his first handover.
Basically, so far the only patient we're looking at is this gentleman in the car. We believe that he's collided with the vehicle in front at about 60 kilometres an hour, a bit faster. He's rolled at least once, come into the tree. He's got a laceration and an abrasion to his forehead, which is under that bandage. We're just about to get IV access, and that's really about all we've got at the moment. All his obs are good. Once we're happy that the patient's fully stable, then the SES will tear the car apart and we'll get the patient out.
The jaws of life, powerful hydraulic arms, are used to prise open the wreck.
Groin straps.
Given his age and the risk of internal injuries, extracting James from the wreck is a delicate operation.
Roll onto your left bum cheek.
A spinal board immobilises his back and neck in case he has suffered any spinal injuries.
That was the biggest MDA I've been at so far, where I've been the first crew on scene. I definitely had a few nerves going on there, but I'm getting a lot better now at being able to take a breath, slow down,
Chest still sore?
Evan did really well in this job. Evan was challenged, working with different resources, people that he'd never worked alongside of, doing work that he's never actually come across. He's performed quite well.
I think, all things considered, he's a very lucky man to have rolled a car at that age and have potentially put your head through the window and connected with the ground. I'd say anyone's lucky they weren't sicker than he was.
As well as his severe head laceration, James broke 2 vertebrae in his back. He narrowly escaped serious spinal injury, but spent 3 weeks in hospital. At Paramedic College, trainees are in their final days of assessments. After 8 weeks of intensive theory, it's crunch time.
I've got a lot riding on this. My future, my whole life plan. I do have a bit of a fear of failure. I couldn't think of anything worse than having to go home and have everyone know that I was a failure.
Today, the trainees undergo a simulated scenario. It will test their ability treating a patient in cardiac arrest.
They're under the pump here. They're not just doing a test like you do at school. They're fighting for their job, and they put a lot of effort into making a career out of this.
Because it's a fairly crucial part of what we do, we have to get this right before we're deemed safe to go on road. So hopefully I've done enough work to get through it.
Blake and partner Alan have been called to a bowling green. An elderly gentleman has collapsed.
You just jump straight on the chest. I'll check for breathing or listen and feel. Don't forget, after every 2 minutes, we stop, check pulse before we defib.
Examiners will monitor every move they make.
Hello. Hello, sir. Can you hear me?
Okay, as you're listening, you can't hear anything coming up the airway, you can't feel the pulse, and you notice that the chest isn't rising.
Okay, so we've got no pulse.
Alan begins compressions to get blood moving through the heart and air into the lungs. Blake prepares oxygen and should then monitor the patient's pulse.
Sound clear? Shocking, clear.
Only 30 seconds in, Blake makes a crucial error.
And we didn't take the pulse.
I was feeling okay when we walked in, and then once we forgot to check the pulse, which is just such a critical thing to miss, as soon as we shocked, I've gone, oh no, what have we forgotten here?
But the assessment is not over yet.
A couple of quick questions to finish up. Indications of cardiac arrest, Blake?
Is no pulse, no breathing or ineffective or agonal breathing.
Blake.
Then, a last-minute curveball.
Show me where the O-ring is on that thing. It's not in that section.
Isn't it? Okay.
It's actually O-ring in here.
I was sure that I knew where the O-ring was. I just felt this feeling of dread, and I thought, oh no, it's this little bit of rubber as my downfall for this drill.
So that's something just to have a look at in the future.
It's a minor technicality, but in this assessment, everything counts.
All right, take a deep breath, and we're done.
Now, it's judgment time.
How did this go?
Well, I was in charge for managing the airway and missing the first pulse check.
I think you guys did very well. In relation to the pulse, bottom line is you religiously checked it after that. Just an important part of what we need to do. We need to confirm before we deliver the shock. The main thing is someone's jumping up and down that chest.
Thank you very much. Thank you.
You're welcome.
Thank you.
High five, mate.
Thank God that's over. Fortunately, we did pass because I guess we could show that we did acknowledge the mistake, and I would have obviously preferred to have checked that pulse, but they're mistakes that I will never again in my life make.
If the trainees get through their final assessment in a week's time, they'll soon be dealing with real patients, with no room for mistakes. Jenna has been experiencing real-life emergencies out on the road for 2 months.
Half your nose is hanging off.
It's been shocking.
It's down to the bone.
And at times confronting.
Sorry, darling.
I think if I did the wrong thing, it could affect the patient's outcome. And that possibly can be one of the biggest fears or biggest mistakes that I'm scared of making.
It's another day at the office. In Sydney's West, 64-year-old Margaret fell over at home. She hasn't been able to move since.
Had a tumble and a fall. She tripped on her own feet, and she's been on the floor for about 3 hours. So why she didn't call earlier? Because she's a little stubborn, I think. How does it feel?
Jenna and Cleone have been called to a house in Sydney's West. Margaret can't move off the floor.
Okay, she's had a tumble and a fall. She tripped on her own feet, And she's been on the floor for about 3 hours.
Her brother Mick has his own mobility problems. He couldn't lift her off the floor.
She doesn't like hospitals, and she took a couple of painkillers. Thought they would kill the pain enough for her to move and get up. Didn't work. Took a couple more after that. Didn't help. And I said, right, ambulance time.
The excruciating pain signals this could be more than a minor fall.
We're going to give her some pain relief intravenously because when we move her, she's likely to have pain.
Jenna prepares a dose of morphine. It will add to the pain relief of the green whistle. Shortly afterwards, an intensive care paramedic arrives to help.
Jenna, what you might need is try and support under her thigh, just in the off chance it may be a fracture. The problem is because she's lying on it, we can't really assess it.
Just go straighten your legs. Keep breathing, Matt. Keep breathing. Keep breathing.
Sorry, darling. Okay, you're doing really well.
Okay.
Her lying on that side of the floor's kind of stabilised it a little bit, so it wasn't really moving the fracture until we actually moved her, and that was when she was in a lot more pain, even after we gave her morphine.
The next challenge for paramedics is getting Margaret out of the cramped house.
Unfortunately, we can't take away all your pain, so it's actually going to hurt a little bit when we do move you, okay? But we're going to be as gentle as we can. Okay, take a big deep breath, love.
Big breath. Big breaths on that whistle.
1, 2, 3.
No! Sorry, darling. Put your right leg flat, darling.
Your right leg flat.
Good girl.
The medicine Margaret takes for a medical condition has swollen her lower legs, making any movement even more painful.
Sorry,
darling. My arm.
We need to get you out of here, okay?
Inch by inch, it takes 30 minutes to get Margaret out of the house.
Ready?
Yep. You're cool.
1, 2, 3.
Tuck your bum in.
Breathe in tall.
Outside, Cleone can make a more accurate assessment.
We can see that this foot is rotated outwards. See, there's shortening of the limb as well. So I can sort of get 2 finger width, about that much of a distance of shortness. It confirms our suspicions that she might have a femur fracture.
In older patients, a broken femur is a major trauma. At hospital, an X-ray confirms their suspicions.
What's wrong with that X-ray?
That should be there.
So the femur's down here, and you can see there's like a dark shadow here. That piece actually should have that piece sitting in it. Her lying on the floor for sort of 3 or 4 hours waiting for help, trying to get up, isn't a good thing. The fact that every time she's moving, these bones are going to be moving and grating and causing more damage, so it makes it harder for it to heal as well.
I was definitely not expecting it to be that bad from when we examined her, so it's a little bit of a shock, but maybe she just has an extremely high pain tolerance.
Margaret will require major surgery and months of convalescence. After the break, a surprise for Jordan. And John Williams meets John Williams.
A weird situation here, I think.
Nothing from me.
Is this a G-up?
4 ambulance crews have just delivered patients to emergency. As John and Jordan deliver another, there's some mischief brewing.
It's just lubricant that we use to sort of put airways in. It's a pain in the neck if you're trying to clean up.
Yep.
But they're good sports, so they'll find it funny. Hopefully.
Oh, you... What was that?
They put lube all over the doors.
I'm going to get you both back.
Was it you? It wasn't me.
Bitches.
John and mentor Jordan have been on the road together for 2 months.
Jordan's been really good. Jordan's really fun and has a lot of knowledge.
They've developed a certain bond.
When you're on the road, I think the sense of humour with your partner is going to be more so acquired. You won't be going home and saying the same sort of jokes you are to your partner, to your mates down at the pub.
So you think it's okay to leave the car like that? I love about this job that you never know what you're coming to. You don't know where it's going to take you and what you're going to see in that day.
It's almost midnight in inner city Sydney. A man has waved down paramedics. Jordan asks trainee John Williams to assess the patient.
Come up here, mate. Take a seat there. What's your name?
John Williams. Very
What?
common name. John Williams.
Really? Your name's
Are you
John
John
Williams.
Williams too?
My name's John Williams.
Yeah, well, how many are there? Come on.
2 in this vehicle.
How did you cut your hand, John?
I was just walking up and then it just happened. I don't know. I didn't touch anything.
Did you fall over?
I think it might have been a bird or something ripped it open.
Let's wipe that up for you, mate. So what have you been doing tonight?
I was just going past some sort of pole. I don't know if it was wood or whatever, but whatever it was pretty nasty.
I thought you said it was a bird.
A bird?
Didn't you say it was a bird?
No, there was two. There was two things happening.
Oh, okay. We've just come across this gentleman, John, who's sustained a bit of a laceration to his hand. Not quite sure how he got it, and he's not quite sure either. It was either a bird or a pole.
Yes.
2 John Williamses.
Yeah. In my school, we had about 100 of them.
Yeah?
Well, that's what
Where did you go to school?
St Pius, Chatswood. Don't tell me you went there.
Is this a G up?
No, that's where I
John,
Brother Grealish.
What are you doing?
Brother Grealish. I mean, who else would know Brother Grealish other than me? Not that.
John and myself have exactly the same name, and he's just said to me he went to the same high school as I went to, which leads me. I think there's something going on here.
No. Look. It's not nothing from me.
With no further treatment required, it's time for John Williams to say goodbye to John Williams.
They're calling us for another emergency. Do you mind if we head off to that other emergency?
Yep.
Thanks, mate. Can I help you with your bag? Or many hands make light work, eh?
Yeah.
All right, I'll leave that with you.
Yep.
All the best.
Yep.
You take care, John.
I shall. Old man River, they call me.
Oh, don't let him call you that. You're fit as a fiddle. See you later, John. All the best.
Yep. Bye-bye.
Bye, mate. See ya. Serious? I'm starting to freak out. I thought you guys were taking the piss.
Next time on Recruits.
Got hit by a car, mate.
A teenage boy struck down. Jenna takes the lead role.
Does anywhere hurt when I touch your legs?
A mystery illness for a UK tourist.
What is actually wrong with this girl?
And a confronting sight for John.
Oh, my gosh.
And for more Recruits action, log on to the website